All right, good morning. It is 10:01. We are going to go ahead and get started. This meeting is being live streamed on Facebook right now. Thank you so much for being with us this morning. We are the EWE Foundation, and this is our monthly talk. This month we are talking about extended bedside manner. And really the conversation is really talking about how important it is for helping professionals and healthcare professionals um, to effectively deliver information to patient populations. And so to those who do not know me, I am Sarita Edwards, the CEO and president of the EWE Foundation. And joining me today for this talk is licensed master social worker, Ebony Kimber. She is going to lead the conversation. Again, we are being streamed live on Facebook. We are also live on Zoom. So if you have questions, you can put them in the chat box or the comments, and we will get to them at the end of her presentation. Also, this event does hold one CEU, one continuing education unit. So if you registered for the event and stated that you would like that CEU, that certificate will be emailed to you if you've joined us live and you stay for the duration of the conversation. So without further ado, I am going to turn it over to Ebony and let her give an introduction of herself, and then she will take the conversation from there. Ebony, it is yours.
Thank you. Hello, everyone. I hope everyone is having a wonderful day today. I'm super excited and honored to be asked to be here and to have this talk with you all. It's something that is very important to me. I am a huge advocate of supportive adults in the helping professional field. And so I'm just honored to be able to do this and to speak to you all. Just a little bit about myself. Again, my name is Ebony Kimber. I am a licensed master social worker in Alabama. I went to undergraduate at the University of Alabama at Birmingham, go Blazers. And I also received my master's at the University of Alabama, so also Roll Tide. And after I did that, I moved into doing some frontline work. I've worked in foster care. I've been a social worker for over 14 years. I did initial work as a case manager where I worked doing frontline work in wraparound services and with young people who was their first time being in foster care. So I provided basic living skills and family support to foster parents and also to families who are at risk of having their kids to be put into foster care. And then I moved on to work at a residential facility for a couple of years as a therapist for older youth in foster care. And then I did some advocacy work for older youth in foster care because that is something that is very important to me and really what inspired my passion for ensuring that supportive adults are in the lives of every single child. And then now I work at an elementary school as a school social worker. So I've worked in a variety of fields and I have come across all types of areas. My area of expertise is really in just therapeutic care. So using a therapeutic lens and in a trauma-informed lens in everything that I do. So whether it's a case management service, whether it's advocacy, whether it's family support, I don't do therapy as much, but even just any type of just therapeutic work with any type of child or their family. I try to do that with a trauma-informed lens. And so trauma-informed care is very important to me. And so I do try to ensure that everything that I do has that tag on it. And we will talk a little bit more about that because even extended bedside manner in itself includes the inner workings of trauma-informed care to ensure that us as helping professionals, we are always coming from that lens. And what that starts with is that we are ensuring that we are examining our own values, our own biases, our own prejudices, how we were raised, how we were educated, and how that affects the people that we serve or that we are called to serve. And so that is my area of expertise. and that is who I am. If you have any questions, please feel free to, this is a free thing. So, I know Sarita is monitoring things. So please don't feel like you're interrupting me. I don't mind at all.
Awesome. Good stuff. Good stuff. Well, we are so excited to have Ebony join us this morning. And again, guys, we are streaming live on Facebook, and we are right here together on Zoom. So if you have questions, you can drop those in the chat box or in the comments, and we will be monitoring both of those to try to get those answered toward the end. Also, the meeting is being recorded. So if you are catching the replay, that is totally fine as well. It will be uploaded to our YouTube channel, and you'll be able to access it from our website. So Ebony, you can start your presentation. And again, the floor is yours.
Okay, awesome. So I didn't do any slides because it really, if you just want to take notes, but just so that you can have an idea of what it is that we are talking about. The first thing that we are going to cover is, who am I talking to? So who is this for? Like, am I the right person to be hearing this message right now? And then why are these the individuals or the areas of expertise that I'm talking to? Then we're going to move into talking about, what do I mean by bedside manner? Like, what is bedside manner? What do you mean by that? We'll talk a little briefly about the medical perspective. We'll talk about the social work perspective, and then we'll talk about my own personal perspective of it, so that we can have a holistic view of what we're talking about when we say bedside manner. Then we'll talk about, like, why does this matter? Why is this important? Why are we even talking about this? What's the purpose of this conversation? And then we will move into the strategies and solutions, because I'm a solutions-based social worker. So I like to focus on what can we do? What are strategies we can do in order to make these things better, or to improve the services that we are providing. So just in case you are wondering what she's talking about, that is it. So the first thing is, who is this for? And yes, it's a series. So this conversation will be extended over a period of time. So this is just the first part of it. Okay, so who am I talking to? I'm talking to nurses, social workers, case managers, patient care techs, mental health workers, anyone who is working in the healthcare field, doctors, dentists, even. If you have, a medical license or a medical degree, this applies to you. Also, if you are a clinician, a counselor, a teacher, um, really anyone who, if your profession is a calling to you to help other people, I'm talking to you. Because most of the people in the helping professional field, you are doing this because you feel something in the depths of your heart that you want to help other people. And so tag, it's you. Yes, it's you. Okay. So I just want to be clarified. And even if you are not in the field, so even if you are a parent, or or a family member, that has a passion for something like this, and it's important to you, you're a helping professional too, because you're in the field and you're being a support to somebody else. So I want to say to the parents out there who have experienced poor bedside manner, this is for you, because this is going to equip you to know what to ask for whenever you go through a situation, or to counteract the situation that you did go through before, so that you can loop back around and know what to do the next time. So that's even for you as well. So I want to encourage you, foster parents, and anybody who is a supportive or desires to be a supportive adult, or even an advocate, this message is for you as well. So then the next thing we're going to talk about is, what do you mean by bedside manner? So the formal definition of bedside manner in the medical field is a doctor or medical professional their approach or attitude towards their patient. So you'll also hear me interchange the words patient and client. In the social work field, we refer to those that we serve as clients, and I know in the medical field it's patients. And for these purposes, it's the same thing. And so in the medical field, it was a very vague definition, and I don't know a whole lot about medical school. I've never been through it before, so I'm not sure. I haven't talked to a whole lot of doctors, but what my understanding is that it's just something that is briefly touched on to just make sure that you have kindness and care towards the patients that you are serving, um, to not get sued. That's what my understanding is in that area. Like, don't get sued, be nice enough to not get sued, right? So that is my understanding in the medical field of what bedside manner is, okay? So if we move on to the social work perspective of what bedside manner is, we don't necessarily call it bedside manner, but for me, it would be visiting families in their homes and the manner in which you approach them, right? How your countenance is, your tone, not having judgment. We and in the social work field, we go a little bit more in depth in this in school. It's about having boundaries as well, having respect and general regard of and understanding the rights of those that you serve. So we even have specific classes in social work school and grad school that focus on this ability to have compassion, to have care, to have empathy for those that we serve. In my opinion, we could go deeper in the social work field even. So even though we are a step up in going deeper in the social work field, I feel like we should go further, right? And my own personal definition of bedside manner is the phenomenal care and concern and support given to a patient or client. Like, to me, the bar should be set high. The foundation of everything helping professional should be in the way that we treat the people that we are called to serve. And I briefly mentioned this in the podcast earlier this week, but I'll go over it again in case you missed it. For me, the best example of bedside manner was my birth story of my son, who is 2. His name is Nehemiah. And my husband and I are first time parents, and we're freaking out all the way, 100,000%. And, we weren't sure what to do when we got to the hospital. We had gone a little early, so they stuck us in the ER for the first hour, which was a huge panic moment for us as parents and just really as husband and wife. And they weren't the kindest in the ER. They just kind of like rushed us in there, stuck us in there, and left us in there. And really, we didn't have a whole lot of communication. It was like I was freaking out because I'm like, oh, no, I'm supposed to go to a room. Like, I can't have my baby in here, okay? And so it was like a whole freak out moment for us. And then finally, when they told us we could go upstairs to go to the room, our nurse was the perfect example of what bedside manner should be. The extended, she went above and beyond from the minute she walked in the room. Her whole demeanor was kind and light. She wasn't panicked, even though we were. She explained everything to us from the minute she walked through the door. She was always constantly checking in with us. She didn't leave my husband out. She knew that we were a team in this, so she made sure to communicate with both of us. Um, Anytime we had questions, she answered them with ease. She ensured that we knew what the next steps were. She was super patient with me because, I was like, I gotta hold out. I don't want the epidural yet. I don't want it yet. But when I was panicked and I was like, I want the epidural, she was like, okay. She was so patient with me. She wasn't upset because I changed the plan at the last minute. Like, she just was so kind, so attentive. And one of the things that stood out to both my husband and I at the end of it was, when Nehemiah was born, he had to, like, he came out a little cold. So they were a little like concerned about that. And so we didn't get to do skin to skin. And so we were super worried. Originally, we were going to have people come to the room and to see him. But then we were like, whoa, there's something happening. We need to like stop some things. And we did have people who were waiting to come in. And when we let her know, like, we're changing the plans, can you just say we won't have anyone? She did it quick, fast, in a hurry. And she handled it. And we had some people who were like not happy about it. And she handled it. She said, I let the front desk know that nobody comes back here. Y'all are good. And that gave us so much peace. I mean, she was just the kindest person. And to me, that above and beyond that she did was extended bedside manner. Just it that is what it should be. And I'm sure that it took her an extra amount of work. That we kind of finished up at the end of her shift, but she made sure to let us know she was leaving. She made sure we knew. I mean, they have the stuff up there, and you can easily, as a nurse, just put the stuff up there and leave. But she made sure to explain to us, I'm getting ready to leave. And we were super sad and we let her know. But she was like, "You're in good hands. This is the name of the next nurse." I mean, just phenomenal. Okay. The communication was key. So when I'm talking about extended bedside manner, this is what I'm talking about for any situation in any arena. We're talking in the education, the way that you are as a teacher or an educator, in meetings with parents and including them in conversations, even as a patient care tech, even if you are the person that cleans up in a hospital. I mean, that is just such an important job, to be the person when a person is staying in a hospital long term and you're the person they see every single day at the same time most of the time, and you're coming to clean their home for that moment. That extended bedside manner extends to that as well. So I wanted to make sure to take the time to explain that and cover that, so that we have an understanding of how far this goes. That it is not only acceptance of your calling, but acceptance as a professional, to go and extend. And it's hard work. Let me say that as a disclaimer too. It is not easy, because sometimes it means that you have to sacrifice your own self. I hear social workers say all the time, "Well, I have my own family. I have my own stuff to take care of." Get it. Me too. Okay. We're all there in the same boat. We all have our own stuff. But in that moment, when we are called to do what we're supposed to do, we're supposed to care for these people who have been put in our care. And for that moment, our needs cannot be taken care of. And there are always opportunities for that to happen, because you never know, like the caretaker had to be caretaked for. The social worker had to be taken care of in that moment, right? So that was touched my heart to remember what I do in my work, so always remember that. So moving on, the next thing we're going to talk about is, why should this matter? Okay, so we've already talked a little bit about this, but that's more of the passionate response. We're going to talk a little bit more about the steps of what we should do. So the first thing I want to talk about is that, honestly, families are being ignored. And I know Sarita's going to talk a little bit about their story, and some of you know it, but there's just so many instances in so many different arenas that I have witnessed as a social worker, that families have just been silenced. And sometimes it's twofold. Sometimes it's silence because of lack of knowledge. I see that a lot in the education arena, especially in regards to special education, especially with me working in education this past year, is that when families don't understand how the education works and how special education works, they don't know the right questions to ask. So they know that their child has needs. They know that there's something going on. They know that their kid is bringing home a horrible report card and constant behavior reports. And there are people giving them all this information, but they don't understand what is happening or what to do about it. I really believe that we, as supportive adults in that situation, have a responsibility to sit families down and discuss with them and explain to them what is happening, why it's happening, and what are the solutions for the next steps for themselves and their child. One thing I have a major respect for in the school that I currently work in is that they treat the child and their family and the school community as a village. So if one of us is in it, all of us is in it, you know? And so they literally have a process where the family in the beginning has to sign a contract and say that they will commit to being a part of the village. So that meaning that when a child is having a challenge, that there will be a team of people who will come and sit down and have an intervention conference with that parent and strategize a solution for how it is that they can to help what is happening, right? So that matters because of that one child. That one child is going to be affected. We're talking about the future of a child potentially either dropping out of high school or graduating from high school, starting in elementary school. And so that's why it matters, because it's the end game, right? We all talk about the importance of our future, of our children, even in the medical field. I mean, goodness gracious, when Sarita and them talk about, I will just give a disclaimer. Elijah's my nephew, okay? So I'm a little partial. But still, I know he's going to do phenomenal things. And there are so many children who have rare disease who are adults now doing phenomenal things. I was watching the Special Olympics highlights the other day, and my heart, I'm like, wow, just the impact these individuals have, not because of their disability, but because of their abilities. And the fact that there are supportive adults in this world who spoke on them or ignored their families, that is discouraging to me. And that's why this matters. And another reason is that it is so important. Talking about that is, it's so important to see the family and that child that is behind the film of the diagnosis, or even the paperwork that is in front of us. One of the things in working in foster care that I learned that really just changed my life is, so many of my kids would tell me, Miss Ebony, I'm more than just my case file. And there would be so many instances that I would read a case file, because I would talk to my kids about their case files and what was in it, because it's their case file. Why would I not? And there would be so many things in our therapy sessions that we would bring up. They were like, that's not what happened. And it would be so much untrue facts in there that didn't happen. And let's be honest, like, especially when working with teenagers, they don't lie in situations like that. They gonna tell the truth. They some of the most honest people I know. Okay. So I know they weren't lying. And so I know that sometimes we use the paper as our guide. Sometimes we use the research as cold hard facts. Sometimes we use what a previous caseworker or case manager has told us as the book, and that is it. We don't go in with our own understanding. Sometimes we use, I love you, my psychologist and psychiatrist. I love you so much, so I don't want you to hear me on this. But sometimes we use your diagnoses as our basis, and we don't ask questions, because sometimes people change. Sometimes we don't get it right. And so the bedside manner conversation is important, because we need to see beyond that, right? We need to look beyond that sometimes. And we're going to talk about some strategies in a minute of how we can do that and what we need to do that. And then the last thing of why bedside manner matters is really, it's the power of empathy. And we talked about this a little bit in the podcast. Is empathy is so powerful to me, because it helps us to examine ourselves. And I have trained many social workers who get a little sensitive in their feelings with me, because a lot of times when we are working in our field, it's easy to see our patients and our clients and what they are doing as a result of their situation, and to make our own biases and judgments off of that. So I'll give it an example. So in social work, especially in the foster care field, a lot of times our foster kids have been in care for over 4 to 5 to 6 years, and sometimes as long as really their whole lives. I've met kids who have been in foster care since they were babies, all the way up until 19, 20 years old. And I've come across social workers when we're having meetings, we call them individualized service plans, ISPs. And I'll ask the question of, where are their biological parents? Have you talked to them? Have you discussed anything with them? And a lot of times I get a very adverse reaction of, oh no, I haven't talked to them. Why would I reach out to them? They were a drug addict the last time I talked to them. They had broken promises. They were not coming to visits. Oftentimes I find myself asking, so how long ago was that? And sometimes it's been like 5 or 6 years since they've talked to that biological parent. Um, but the key is they haven't talked to the child and asked them, have you talked to your mom or dad? And almost most of the time, they've talked to them. And so I tell social workers all the time is I want you to put yourself in the shoes of this child. I want you to think about what the experience is like to be pulled from your home at birth, 7, 8, 9 years old, and you've already established a strong relationship with your parent. And somebody is telling you that you can't talk to them anymore, you can't see them, you can't have them for birthdays, you can't, like, none of your celebrations, and what that would feel like for you. And so I asked them that question because if you can't put yourself in the shoes and think about that, if you cannot put yourself in the shoes of a family who's experiencing a medical crisis, where you're telling them that you're giving them a death sentence for their baby, for their child. And you can't do it in a manner that how you would want somebody to do that for you. That is a problem because it changes the trajectory of the profession that we are in. We talk a lot about, and I was joking about being sued, but it's really more than that. It's more than that. It's more about the integrity of the work that we are doing because so many people like everybody has to utilize our services at some point, especially in the medical field. Everyone's going to come in contact with a nurse. Everyone's going to come in contact with a doctor at some point in their life. Most people should come in contact with a social worker or a therapist or a counselor, but they don't. But they should. We're normalizing this in our society. I'm determined on this. Everyone should. So the fact that we as helping professionals are so present in the world, we have to make a more general effort to ensure that we are being empathetic every single second when we are doing the work that we are doing. And so now we come to the portion of, well, Ebony, how do we do that then? So what do we do? So now we're to the part of strategies to improve our bedside manner. And really what I really want to focus on is how to have a care plan. Okay. So it needs to be twofold. Okay. So the care plan needs to be your own personal care plan for how you are going to improve your extended bedside manner, and then it's going to be the next steps for, okay, when I come in contact with a patient or a client the next time, what am I going to do and how I'm going to do that. So that's what we're going to do. We're going to end a little early, so I'm putting that out there. All right, so strategies. So the first thing is, to me, a key. And let me just go ahead and do the disclaimer of this is from a lens of trauma-informed care. So if you've never heard of trauma-informed care before, it is the thought process and the practice of making, and I want to use the word assumption lightly, but just having a general observation that the person in front of you may have experienced something in their life that may affect the way that they are presenting themselves. And how trauma does is it affects your ability to handle stress, or really even the manner in which you handle stress. So basically what that school of thought says is, for instance, as early as when a baby is in their mother's stomach and they're experiencing either substance abuse from the mother, or they're hearing or experiencing domestic violence or any type of violence, that somewhere later in life that will have an effect on their brain development and the way that they respond to stress. And there are different types of ways, but they say that you respond to stress in 3 types of ways: fight, flight, or freeze. And there can be a variety of different variations. I know that there's an extra one, but that's going too deep. That's a whole nother webinar. It would take us forever to discuss that. But either way, that is just a foundation along with empathy. So empathy and trauma informed care should go together. Um, that is the way in which you should approach people. So maybe my patient is having an attitude with me because they've had a bad experience with medical care professionals in the past. So they're automatically responding in a fight response because they're feeling like every single medical professional that they come in contact with is going to have that adverse feeling towards them. And so their synapses in their brain is firing off, telling them that it's a warning that they need to get in a defense mode. So they're snapping at any medical professional that comes in contact with them. And most of the time those are going to be your difficult patients that nobody on the floor wants to handle because they're difficult, right? um, in the social work field, that is like a child or a teenager who constantly runs away because their stress response is flight, and it's because there's potentially past trauma in their life when they were at home with their family, that whenever something happened, domestic violence, abuse, physical abuse, emotional abuse, sexual abuse, that the only way that they could keep themselves safe was to run away. And so now that is ingrained in their synapses of their brain to fire off like, when there's danger, I gotta go. That's the only way I could keep myself safe. And so what the best counteraction for that is going to be, for us as helping professionals, is to build relationship. You have to get to know people. And one thing I will say is, in this solution, please make a note of that takes time. And it is difficult in the medical field. It's difficult in the medical field. And it's difficult because a lot of times the medical field is short term, right? A lot of times a doctor, I know when I go to the pediatrician with my child, like the doctor probably only spends maybe 15 minutes in our, in our space at the time. So it is short term sometimes, but you can build relationship in 15 minutes. You can. Now it's sometimes it may be a little bit difficult, it may be a little hard, but you can. If you go with the intention that I'm going to build a relationship with these people that I'm going to see, then that is you making the effort. That is you using the power of empathy. That is you using a trauma informed care lens. So I don't want you to get caught up on, because I already know the counteractions. I already know I don't have time to build relationship. I know, I hear you. But the thing is that you may set a foundation for the next person to build a relationship, because maybe it's just building a relationship with the medical field in general. Maybe it's just building a relationship for the next person that you are passing them on to. So always note. And so just a couple of tools is getting to know the families. I am so calmed by a pediatrician or even a doctor who takes 5 minutes just to sit and talk to me and just ask me, how are you doing? So what is your name? Do you have kids? How many kids do you have? What did you guys do this weekend? What did you do for the summer? Just something to get to know them, because that puts people at ease. It is so much more ease than somebody that comes in and is like, okay, and you're looking at a chart and you're just like rattling stuff off. This is what's happening. This is what you need to do. What pharmacy are you at? And then that's it. And you're gone. And it's like, what just happened right now? So it's just the power in just taking the time to be relational to people, and understanding who they are, and then pass that information along and make sure it's truthful information. Like this also includes the power of listening and making sure you are retaining the information that they are giving you. Because I know, like, when you go to a doctor's office, you see the check-in nurse, then you see the actual nurse, then you see the doctor, and how powerful it is if you as a nurse go to the doctor and say, oh, they have 3 kids, just to let you know. And the doctor to come in and say, so tell me about these 3 kids of yours. Do you know how much that would light up somebody in your room to know that they went and told that and you brought that in? Being relational to people is so powerful, so powerful. And so if you just set that intention, and it's so simple too, it's just a simple solution for you to change the way in which you interact with people. So make that number one a part of your plan is be relational, build relationships, get to know families. Number two is when you get into the nitty-gritty of stuff, right? And sometimes it's heavy, sometimes it's the next steps of a plan of what are the next steps are for this child. Develop a plan with everyone involved, right? So this is an extension of you building a relationship. So you're going to find out who is in that relationship. In social work field, we do an intake assessment a lot of times because we have the time to do that because we have to build a treatment plan. So it's already built into the social work field. But social workers, let me be clear, okay? When you're doing your intake and your treatment plan, you still need to be relational. Don't just ask the questions on the sheet. Actually have conversations. Okay, that's just a little tidbit from my social workers. But when you're developing the plan, you should already know who the parties are involved. So it's the wife, the husband, the other children, a grandmother, an aunt, and make sure you include those people in there, especially in the education field. Make sure those parents have a support, somebody to support them, somebody who can ask questions, and do not get intimidated. Don't get intimidated by people. I know a lot of times I attended in the education field, they call them individual education plans. A lot of times I attended those plans just as a support to a foster parent or even to a teenager. And the amount of offensiveness that the adults in the room felt because of my presence there, because I was just asking questions for solutions, was so off-putting to me. I'm like, but we're supposed to all be here for the same purpose, right? Are we not all here for the same solution? I'm not here to call you out on your job and tell you you're not doing it. We're just trying to find and create a plan so that this child can be successful. That's really all it is. And so if you can cast, again, it's like that own view of self and observing that and casting it aside for a second just to be empathetic for whoever it is that we're there for. So, and ask for their input. Ask them how they feel. Like you can have a plan, especially in the medical field. I know, like doctors and nurses, y'all know what y'all talking about. Okay. I don't know anything about that stuff, but I need explanations, so that I can say, okay, I don't know how I feel about that. Is there another option? And allow them to be able to discuss that. And I know we're Google doctorates. I understand. We have doctorates in Google, and sometimes it's irritating because I'm cum laude, so I get it, and that's irritating. And you can shut it down. That's fine, but it comes to the relationship, and you building the relationship with people who have cum laude and Googled them, and you can shut them down, but still, like, it's just the power of listening and listening to those fears and listening to those misunderstandings that they may have and clarifying that. And sometimes it takes time. That is a huge theme in this, is that sometimes it takes time. It takes time. But make sure that when you are developing that plan, you allow them to have the input. Okay. So number one is building a relationship, being relational. Number two is developing a plan with all parties involved. And then lastly, and by far, this is not lastly, because this conversation can go on forever. But for this purpose of this conversation, this is the last thing, is just make sure you have continuous follow-up, right? In social work field, we call it aftercare. Sometimes it looks a little different. Sometimes it's 3 months after. And this is a systematic change that probably needs to happen really in the medical field and the educational field. So we're talking big wig stuff, but still it needs to be talked about. Is people need to be followed up with. Especially I haven't talked a lot about the mental health field, but for my mental health workers, it breaks my heart when I see an individual who especially has just been recently discharged from a psychiatric unit, and they're struggling to figure out how to get the medication, where to go to get it, or they don't have the money for it. And it's because that work wasn't done and the empathy and relationship building before they were discharged. But how powerful it would be if there was somebody to follow up with those individuals after, to ask the question, did you get your medication? If not, why? Tell me how I can help you. Okay. So there's just power in that. There's power in the education field of following up with parents on what it is that they need or what questions they may have after an education plan is made. Instead of just implementing the plan, to give updated reports, and even in medical field, like had a nurse or a case manager following up with families. Tell me how your heart is. How are you feeling? Do you have any questions about what we talked about or discussed? Have you gotten any new information? You want a second opinion? Okay, here's some possible suggestions that you can go to, you know? And so all of that is just super powerful in continuing to build and extend the relationship in your bedside manner. And it is going above and beyond. It is. It's going that extended mile. But wow, how powerful it is for the families, the patients, the clients that you work with. Because one of the key and a bonus I'll give to you is that what it is you're being sensitive to their strengths and needs, and you're empowering them. So empathy, really the result of that is the empowerment of the people that you're working with, is to empower them to know that somebody cares enough for them to take the time to listen to them, to care for them, to give them what they need. So just being sensitive to the fact that they have the power to get through whatever it is that they're going through, and the professional that is there with them is encouraging them and extending that bedside manner to them, to encourage them that I'm standing with you in this and that you can do this. So I hope that that's helpful. I hope that that encourages someone to make a shift, make a change in the way that you interact with those that you are serving. It is not overnight work. Don't think you have to go to in today on your night shift tonight and do this and be perfect. Okay. That's not what I'm saying. I'm just saying to start the work by changing your heart in it today and make the efforts to do this and extend your bedside manner past what you learned in your schooling.
Awesome. Good stuff. Thank you so much. So I have like a notebook worth of notes over here. One question that I had that I wanted to ask, it says, when is it time to report
Mm,
how you've been treated in terms of poor bedside manner? And of course, I think that answer stretches. I'm going to give you the opportunity to answer that, and then I'll chime in with my 2 cents on it.
yeah, that's a whole nother lesson, isn't it? So yeah, I listen, this is why I said in the beginning, this information is great for families, for patients, for clients. Like I want you to have equip yourself with this information, because as soon as you see it, report, share it, report it, share it. I say don't wait. Don't let yourself suffer through it. Don't let yourself suffer through it. Speak up. And there's a way that you can do it, because empathy extends to everyone. So even as the person receiving the care, you can extend that empathy as well to because we know we are helping professionals ourselves. So we know that we go through our own personal things. We are experiencing, sometimes we take that to work. And so if everyone goes in the lens of empathy and understand, like, okay, this doctor right now is not treating us the way, is not giving us the extended bedside manner in the way that we need in this moment. So what are the next steps? So then you say, what are the next steps for me in order to extend empathy to them, but also get the needs of my family met? And that is a plan. That's going to be the thing we talk about, is what is the family's plan to go into what the next thing is. So you need to have your plan together before you even get there, to know, okay, if a medical professional is not showing the extended bedside manner, this is what I'm going to do. So that might be our next talk.
Oh yeah. Let me go back. I'm changing my view. And I think I have to agree with you 100%. I think when it's time to report, it's all about your own personal perspective. I think sometimes some folks can tolerate a lot more than
Mhm.
someone else. And so, you know, s- um, someone may be willing to give that physician or whomever another try, even if it's an inpatient stay or whatever the case. And so I think I agree with you 100%. I think it's all about when you feel
Mhm.
that you have reached your breaking point with that doctor or whomever. I just wanted to kind of recap a lot of the things that you said that I think is really important just overall with the conversation. I know when it comes to having this conversation, even with your background being foster care, and now just elementary based student populations, just in the healthcare space, it was really important to us to reach out to social workers and nurses and helping professionals in trying to push our efforts of education, because in our arena, social workers and case managers are a lot of times the face of the patient population. Um, a lot of times, doctors and other specialists, they speak with the social work team or the case managers before they ever talk to the family. And so I think building the relationship with social workers and case managers and just the helping professionals, I think is so important when it comes to empowering the patient, and then giving the patient that opportunity to feel that someone is on their side, because a lot of folks aren't comfortable talking to healthcare professionals. And so having a right now tangible resource in someone like the hospital social worker is huge in making sure you receive the care you feel like you deserve for yourself or for your child. Um, I think too, it was really important when you spoke about, you know, the bedside manner extending past the people who you think it applies to. A good example was the environmental services person, and there being the person that you see all the time if you're in the hospital. The one thing that stuck out to me was how many times the environmental services person or the machine tech who comes and check your equipment, how many times do they come in and actually remedy the poor bedside manner that you received from the professional, right? Like they come in with a different perspective and a different zeal. They ask you the questions about, how long are you here? Is the baby okay? And I think that a lot of times it's those folks who are often overlooked who actually um, gives you that sense of we care that you're here, right? Like, and so I think it's huge to um, celebrate them, because a lot of times they make situations easier, because they give a different level of care about your situation. Um, the piece about families being ignored, that is so across the board, whether it's the healthcare space, the education space. I think a lot of families feel that they have been ignored to one extent or another. I know in the rare special needs space, we have felt ignored in the healthcare realm. We have been denied uh, medical treatment and services, and and we did fall under the umbrella of not knowing the right questions to ask at the time. And so I think it's important to have conversations like this, just really casual conversations where we can empower people to know that you may not know the right question to ask, but start with just saying, listen, I don't like that plan. Like you said, can we do something different? Because that's what happened for us. We didn't know what we wanted to do. We just knew what was being presented wasn't what we wanted to do. So, and that's honestly the approach we took. We don't like that. Can you give us another option? Um, and so I think it was just a really, really good conversation. One of the last things that I wanted to touch on too was the conversation of empathy. I think sometimes we convince ourselves that in order to be empathetic to someone, we have to have a relatable story. But empathy is really being able to put yourself in the story and see yourself as the person who you are talking to. And so I think is really important, especially again for honestly for everybody. But I can really just relate it to our experience and the encounters that we've had where there seemed to be no empathy, there seemed to be no concern, there seemed to be no regard to anything but what was medically documented. And I think, it's really important that you touched on that. You have to extend yourself past what's before you. Statistics and data is great. I like having the facts, but I think when what's before you is clearly showing you something other than what you have on your sheet of paper, it's time to change that conversation. And in a lot of places, that's not happening. Um, and so we have about 8 minutes. So you feel free to just chime in, but those were a lot of the things that jumped out at me as you were talking, the trauma-informed care, fight, flight, or freeze. Listen, we tell ourselves, Kareem says we went from being angry to aggravated to now we're advocates. In my mind, our angry was the flight. We got the information and we were ready to run. What are we dealing with? We don't know what this is going to look like. I remember feeling at the maternal fetal medicine doctor, I remember feeling like I don't want to be here. That was me trying to flight. I was trying to get away from being told that this is what we were going to be dealing with. Freeze was our aggravation. We just sat in a place of aggravation. We didn't know what we were going to do. We didn't know what to turn. Nobody was offering us anything other than death. And so we were just in a moment of stagnation. We were just standing still. And then in addition to that, we were standing still, but we were also feeling isolated, right? Like we were feeling like there was nobody giving us any hope. Nobody was giving us any encouragement other than it'll be okay. Like that's it. That's it. And then flight, no, 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 fight. Flight was angry, freeze was aggravated. Fight, that's what we are now. That's our advocacy. Like we are doing everything we can to make sure no other family experience what we experienced. And like you said, that's something that's going to take time. It's not something that's going to change overnight, but you can rest assured that we are doing everything we can from community education and trying to talk to patient populations to legislative action to make sure we change the narrative around how people get information, how people uh, understand information, and then how folks can utilize that information. Um, and then lastly, the building relationships. That is so important. And just to piggyback off everything you said, when it comes to building relationships, to me, it really starts with establishing trust. And I think you have to put yourself in a place to where the people who you are trying to build those relationships with, they trust what you're bringing to the table. I'm a huge advocate of um, I don't like empty relationships, right? Like I don't have the bandwidth to try and be in every circle and to be in every situation, right? Like I need to be in places where there's actual relationship building and we're doing something. Otherwise, like that's sometimes that's a waste of time. I'm not saying discount social interactions or anything like that, but I mean when it comes to trying to empower communities and patient populations, you have to be in a place to where the relationship, it starts with that trust, and then you're actually trying to um, build those communities up by putting them before the right folks and the right resources, and making sure folks are good. So those were just really, really good tidbits. I still have like a page more. I have like a whole sheet over here, right, of information. But I did not want to extend past the hour. This conversation, like you said, can continue. There are so many other talking points and topics that we can pull from this conversation, and we'll do that. We do plan to host these once a month. We do have our podcast. If you haven't listened to Ebony's podcast episode, it was posted last week. It's titled Extended Bedside Manner, and we are talking about this stuff right here, but it's really like 15-16 minutes of nuggets um, that you can go and listen to that on our Being Rare podcast platform. Um, and then the video will be available on YouTube and on our website. It is streaming on Facebook, so you will have access to it there. If you have any other questions or you want to connect or reach out with Ebony, her information has been plastered on everything that we've posted. So you can click the little blue piece of her name and that'll take you directly to her. But feel free to reach out to us and we can connect you with her. Um, and Ebony, we've got 3 minutes. I'm gonna let you wrap us up and close us out.
But this has been so much fun. Like I could talk about this stuff all day. So I'm super appreciative. I hope that it changes the mind of helping professionals everywhere. And the one thing you said, Sarita, that is really the whole of it all is that the effects of trauma can be changed, right? And turned around and used for good. Like you all took that trauma and have turned it into that fight response into something so powerful. And that is what it's about. That is what it's about. And so that's why I'm like, listen, let's shift the paradigm together, like, and make this a thing. Like the big theme for professional development with Ebony Kimber is think outside the box. And let's think outside the box together and do things differently so that everybody can really just change.
That's so good. Think outside the box. I always say, Kareem and I, we would always say, um, not only are we thinking outside the box, there is no box,
Nope.
right? Like take your box and you can
Yep.
throw it somewhere. Like there is no box, because I think you have to have, and that was before being on this journey with Elijah. I think you have to always create a space to think differently. Even in the worst scenarios, there is always an opportunity to change perspectives, whether that's yours or someone else's. And that's just the best way to live. Otherwise, you find yourself um, consumed by stuff that honestly you can't fix or you have no control over. And so it's just easier sometimes to change the way you think about situations for the good. Don't get sucked in changing the way you think um, if it's going to keep your situation as it is and it's something you want to change. That's not what I'm saying. I'm saying keep yourself open to learning something different, and keep yourself open to doing something different. And that's on both sides of the spectrum, whether you're the helping healthcare professional or if you're the patient family. Just always keep yourself open to learning something, always keep yourself open to doing something differently. So it is 11 o'clock, and we are going to see you guys on the next episode of this conversations. Again, check us out on all of our social media platforms at Everyone Is We. Until the next time, y'all keep being rare. We will talk to you soon. Thank you, Ebony, for being with us.
Thank you. Bye.
Bye, guys. Thank you so much. So now I have to figure out how to shut everything off. Let me see.